And Remunerations Commission has ultimately yielded to demands for special allowances and benefits for frontline health workers who are intricately involved in the war against COVID-19 pandemic. Now, the Commission, in a letter addressed to the National Treasury and the Council of Governors, has approved a 3 billion shilling expenditure to give frontline soldiers in the coronavirus fight allowances of between 5,000 and 20,000, as well as medical cover for 15,000 health workers in 22 counties who were previously did not enjoy cover. As our very own Francis Gachuri reports, it will cost you nothing to be tested, isolated, treated or quarantined in a government health facility.
Medical workers in public health facilities have scored a quick victory against the Salaries and Remuneration Commission SRC after weeks of battling over allowances and benefits for frontline soldiers in the COVID-19 combat. In a letter addressed to National Treasury Cabinet Secretary Ukuri Atani, his public service counterpart Professor Margaret Kobia, Health CS Mutahi Kagwe, and Council of Governors Chairman Wycliffe Oparanya, SRC has approved a 3 billion shillings expenditure to cover medical emergency allowances for health workers for 3 months effective last month. The special allowances will vary according to categories of the health workers. The top category will comprise medical doctors, dentists and pharmacists, who will each earn 20,000 shillings per month. Clinical officers, nurses, lab technicians, biochemists, entomologists, parasitologists and physiotherapists will earn an extra 15,000 shillings per month. The third category will involve community health workers and assistants, promotion and records officers, social and public health workers, occupational therapists, radiographers, drivers and mortuary attendants, who will each receive 10,000 shillings in COVID-19 allowances. Support staff members deployed in public health facilities, among them cleaners and boiler assistants, will earn an extra 5,000 shillings per month. The allowances will cost county governments 2.3 billion shillings, the Ministry of Health 104 million shillings, and state corporations 451.6 million shillings. Another 520 million shillings will be spent on provision of medical cover for 15,000 workers in 22 counties who previously did not enjoy any scheme, as well as psychosocial support for health workers.
You are fine, huh? You've not had any symptoms, eh?
At the same time, the government has yielded to public pressure and waived coronavirus testing, isolation, treatment and quarantine fees in public health institutions.
Effective today, government quarantine facilities will be occupied by those told to do so by the Ministry of Health. We will be given that facility free of charge. This is to facilitate those who may feel that they do not want to go for testing because of the cost of quarantine. That is no longer the case.
Francis Gachuri, Citizen TV.